like that. Okay, ready? Hello and a very good morning to you. Thanks for joining us for our virtual conference on the pressing issue of how the NHS can reach carbon neutrality by 2048. Welcome to new faces here for the first time, and hello to those of you who join us regularly for these conferences, packed full of useful content. The National Health Executive is always keen to deliver content which inspires innovation on the platform long after the event has finished. To access the on-demand content, please visit events.nationalhealthexecutive.com/on-demand. Today will be no different. It will be full of opportunities to network and acquire industry knowledge and best practices from other NHS professionals. So I really hope that you're looking forward to what we've got in store. A big thank you to the industry leaders and experts who've taken time out to join us to share their high quality insights. Due to the standard of content that will be shared on our NHE 365 platform, it is worth me pointing out that all the content is CPD certified. So for every hour of content that you watch live, you'll earn 1 CPD point. To receive your certificate, please just email the NHE team at marketing@cognitivepublishing.com. That's marketing@cognitivepublishing.com, and they'll provide you with a copy. Our networking opportunities can be accessed via the speed networking function, and I really encourage you to collaborate with your colleagues as another valuable source of education. This all plays a part in the community we're growing to extend the reach of knowledge and connections shared today, which can be accessed at any time to fit in with your busy schedules. Also on the NHE 365 platform, access to a wealth of resources on our on-demand content section alongside the digital marketplace, providing expertise for you and your teams to digest at your leisure. Finally, do share your thoughts and experiences today across social media. Great if you can use the hashtag NHE365. So without further ado, let's get started. On July the 1st last year, the NHS became the first health system to embed net zero into legislation through the Health and Care Act 2022. This put a requirement on NHS England and all trusts, foundation trusts and integrated care boards to act positively towards decarbonisation and meet the statutory emissions and environmental targets. In addition, each body is required to create a localised green plan and appoint an accountable board-level net zero lead. Under the appointed net zero lead, department shareholders will be responsible for key actions. For example, estates and facilities key stakeholders are tasked with reducing carbon emissions in the following areas: improving energy efficiency and reducing energy usage, decarbonising heating and hot water systems, waste reduction and the circular economy, and building design and refurbishments. Organisations are advised not to actively consider offsetting and to instead focus on efforts to tangibly reduce carbon emissions. So with that, I'd like to introduce you to our opening keynote speaker, Pete Waddington. Pete is the National Net Zero Lead for the Academic Health Science Network, an organisation which supports the 15 AHSNs across England to spread innovation at pace and scale within the NHS, improving health and economic growth. Peter spent the last 5 years working on a range of innovation projects, including ones to help improve efficiency and quality of care in areas like cardiovascular disease and cancer. So, Pete, welcome. Our virtual stage is all yours.
Privilege today to open this session for you. Next slide, please, Jack, when you've got those up. As Helen said, I'm Pete Waddington. the Net Zero Lead for the Academic Health Science Network. Sorry, Jack, I can only see half the screen. Because thank you. There we go. Lovely. So I'm just going to open this session up to talk about innovation, actually, how we can support the NHS towards net zero. I'll briefly talk about the work of the HSN, how we support innovators, give you some examples, talk about some challenges to achieving net zero, and talk about some future opportunities. Next slide, please, Jack. And before I do that, though, I don't think I could sleep at night unless I gave you some context And I just want to start off with this carbon budget. Next slide, please, Jack, if you keep whipping through. So the carbon budget, for those that don't know, sorry, I didn't play actually, so just go back a second. But the carbon budget effectively is how much carbon we can release into the atmosphere. There we go, it's playing now. Before we hit that massively important 1.5 degree target. And as you can see, as the years are going by, it's increasing dramatically. And in fact, we've only got 8% of the carbon budget left before we hit that 1.5 degree target, or less than 10 years. Next slide, please, Jack. Sorry. So this graph, I'm not a statistician, but you can see historically how the carbon emissions have been going up, and there are the trajectories, what we need to do to get to net zero. Now, if you just look at how steep those lines are, that really does set out the scale of the challenge. Next slide, please, Jack. And in fact, some of you might have read the recent Intergovernmental Panel report on climate change. And when you do read that, let's be absolutely clear, it does state that it's highly likely that we will exceed that target. And that has massive implications. Next slide, please, Jack. And I quite like this visual. It plots basically, where you were born, what the future is going to look like based on different scenarios, and how hot the planet is going to get. And when I was walking the dog the other day, I was thinking, I know where hopefully I'm going to be on that if I do enjoy old age, and I think about my kids and stuff. It's going to get hot. The planet is absolutely going to get hot. And we've seen that already last year. People are dying through climate change all over the globe and in the UK. And we really need to let that hit home a bit. Next slide, please, Jack. So there's just a little bit of context. There are other reports out there. There's a recent one on plastic. I mean, plastic production, it's not sustainable. It's causing significant harms to human health, harms that the health system are currently having to pick up, and it causes massive societal injustices. So again, we've got climate change, we've got the plastic, the waste pollution problems. There's a lot going on planet Earth, and we absolutely need to address it urgently. Next slide, please, Jack. Those of you that aren't familiar with the Greener NHS strategy, I just wanted to take these two graphs. The one on the left is what the NHS needs to do to get its own carbon footprint to net zero. The one on the right is its carbon footprint plus, and within there you see things around decarbonising the energy infrastructure, buildings, models of care. At the bottom, and it's not in an order of importance, but there's the research, the innovation, offsetting. But actually, my thoughts are that innovation cuts across all these. We see innovation in the energy industry, in the estates, models of care, and we need innovation to support our supplies with net zero. Next slide, please, Jack. Just a little bit about the HSN then. For those that don't know, we're the innovation arm of the NHS. We're seen as connectors, collaborators. We connect industry, academia and the NHS together. And there's 15 HSNs up and down the country, and I work at a national level. But if you're not connected to your local HSN, please do so. Next slide, please, Jack. So I just want to talk briefly about the role of innovation in net zero. Innovation is essential for achieving the ambitious goals of net zero emissions, which requires a significant transformation of the current economic and energy systems. It can take many forms, including the deployment of new renewable energy sources, advanced battery technologies and sustainable transportation. It can also involve the creation of new business models, policy frameworks and financial instruments. But by investing in research and development and fostering a culture of innovation, we can unlock those new opportunities for sustainable growth and create a more prosperous and resilient future for all. Now, I didn't write that. ChatGTP wrote that for me. And some of you might have seen the latest news around AI and just how advanced it's getting. But actually, I thought that was a really good paragraph description about the role of innovation and some key areas that I've just highlighted there around new models of care. Around the opportunities, around the culture. So I'm going to talk a little bit more about AI and innovation in a second, but it's on our doorstep now, and we can use it to help achieve net zero. Next slide, please, Jack. So the HSN, we do lots of work with supporting innovation into the NHS. We do lots of sharing and learning events. We've just done a couple this year on energy innovation and air pollution. The next one we've got on the 28th of April is around data, carbon accounting and monitoring impact. And the reason I wanted to do that is data is absolutely key to achieving net zero. we must keep understanding the data. We must keep measuring the impact. And that's beneficial for numerous reasons: to know where we are, to know where we're going, to develop the strategy, and more importantly, hopefully celebrate success along the way. Next slide, please, Jack. So I'm just going to give you a feel of some innovators that we work with. Starting with an organization called CO2 Analysis. I'm not going to go into depth in any of these examples here today, but there are lots of further information that you can check out. But CO2 Analysis are doing lots of work around carbon accounting. They're going to be at the event I've just mentioned. They're doing lots of work on machine learning and AI. In fact, last time I spoke to them, I think they had about 65 million records that they were basing their carbon accounting platform on. Next slide, please. Definition Health, they're on our digital accelerator, our digital North accelerator, doing some brilliant work around the surgical pathway and looking at how they can change surgical pathways to directly reduce carbon. We know that the surgical pathways are very carbon intensive, so Definition Health are a good example of that. Next slide, please, Jack. As our Open Medical, again, a company that the HSN know really well, been successful with some SBRI funding. They're looking at the carbon footprint of operating rooms, hospitals, as well as more granular calculations like papers and letters that take place in those procedures and the surgical equipment. And they've built that into a dashboard that again helps with the data, helps change the culture, helps change them pathways of care. Next slide, please, Jack. Patient Knows Best is another example of a digital company. Again, patient empowerment, the patient record held, that's really important for changing behaviors and to change care. And again, they've done some brilliant work quantifying the carbon impact of their innovation across some known pathways. Next slide, please. Jumper, an engagement, staff engagement platform, again, helping change that culture. They're currently working with 24 trusts across the country, and they're helping quantify the carbon that they've saved by changing those small behaviors. Every member of staff needs to help change their behavior. Next slide, please, Joe. Be Braun, another good company that I know very well. They've got a knee sensor that helps prevent people when they've had a knee op, that they don't need to keep going back into hospital for physiotherapy. And at the bottom of there's a hyperlink. They've just done a life cycle analysis on their platform as well, on their products, which is really good. We're starting to see companies understand the importance of building net zero considerations and what actually the benefit might be to the system. Next slide, please. Revolution Zero, again, another company we know really well, doing some brilliant work around reusable PPE, decontamination units on site, circular economy, making sure they think about everything from the waste, the water that goes into the reusable PPE, how it gets reprocessed in these decontamination units. So a really good example. Next slide, please. And just a couple more. UMaker, we're working very closely with an organization called UMaker as part of the Sustainable Medicines Partnership. They've got a medicine carbon footprint calculator, the MCF. Again, we must help people understand the carbon impact of medications. It has a massive carbon footprint, and helping people understand what that carbon impact is will hopefully help change behaviors, prescribing behaviors, etc. Next slide, please, Jack. Yeah, we've got lots going on. Digital accelerators, there's 4 HSNs working together. They're launching a net zero NHS digital accelerator program. So there's 8 companies on there. Next slide, please, Jack. So there's lots going on. There are more and more examples that I would love to have told you about today, but obviously time permitting. And there are more emerging, but we must help the NHS keep articulating that it does need innovation to get to net zero. It won't do it without innovation. So events like this today are brilliant to shine that spotlight. And we must keep banging that drum. Next slide, please, Jack. Just some challenges to adopting net zero from my perspective as well. Obviously, there are a lot of system pressures going on, pressures on waiting lists. We've just had a massive global pandemic pressure. The time to think for people in the NHS is absolutely difficult. So this unfortunately does add another system pressure, but it's a very important system pressure. And I think we need to help people understand the urgency. So to get innovation adopted on net zero, we've got to get people to understand why do we need to do this? That's why I wanted to start off with those few beginning slides. Understand the consequences to us, to our families, to the planet. We must keep telling ourselves why this is important. Finding solutions is sometimes a bit of a challenge as well. What is the right solution? Innovation is always evolving, and so it should do. So we've got to help people find those innovations. Articulating the business case, you're going to hear in a bit around business case and funding But that is vitally important. There's some brilliant innovation out there, but we've just got to help people write that business case, get the funding to get that innovation embedded. Risk appetite, and people sometimes are a bit comfortable in the way that they always do things. And the skills and knowledge, again, is vitally important. And I love this quote on the right, but we'll go down in history as the fair society that wouldn't save itself because it wasn't cost effective. And I think there's a lot of truth in there. Next slide, please, Jack. I just want to finish on the last couple of slides. You know, Star Wars. I'm a Star Wars fan. But what do we see in Star Wars? We see robots, drones, artificial intelligence. We see intelligent voice-activated robots, manufacturing robots, logistic drones, etc. Equipment that can help people fly. And there's lots more in Star Wars. Next slide, please, Jack. But actually, when we look at Star Wars and the world today, we've got on the top left is Amica. It's a humanoid robot. It's just been plugged into ChatGPT. We've got drones that deliver just below there on the left, Zipline. We've got Boston Dynamics, advanced robotics. We've got people flying in drones. We've got jet-powered backpacks. We've got little robots that deliver your groceries. They're starting to appear all up and down the country. I think they're in Manchester at the moment. Next slide, please, Jack. So why am I telling you all this? Next slide, please. Well, the reason being is that Star Wars is a good example of how humans are very good at implementing innovation to meet a vision of a future world. So we're very good at thinking what a future world could look like and then deploying the solutions and creating them. But we need to ensure that this future vision is green, sustainable vision, using the technology that we already have, like AI, and that will continue to emerge. But we must help people show that vision. Just a couple of images at the bottom there of brilliant, smart green cities. And that's the kind of world that I want to live in. Next slide, please, Jack. And healthcare as an anchor institution, it needs to help society with that vision and articulate what good green healthcare looks like and how that fits with the wider society and how it can benefit the wider society. We must keep articulating that to people. Next slide, please, Jack. So yeah, just in terms of innovation, there is a lot of innovation that's already here. If I think about my role in the HSN, I've seen solutions on how to change pathways of care. I've shown you some examples today. We've got examples of how to decarbonise the estate from the energy infrastructure, how to generate and store renewable energy. We've already got innovation in that area. We've got alternative materials to plastic. We've got lots of work around data, machine learning and AI. We've got people doing great work on circular economy. And again, I'm a big fan of it. We've got things in innovation to do with nature, and there's lots more. But to do this, we need to have that clear vision, and to implement it, have that clear vision and help navigate some of those barriers that I outlined. Next slide, please, Jack. And if we don't do that, unfortunately, you know, I don't want it to sound too bleak and scaremongering, but actually that is the reality. It will lead to catastrophic and irreversible impacts. And that will increase people's poor health, and it will and has done increase deaths, which the health and social care systems across the UK and across the world will inevitably struggle to respond to. It'll just, you know, we're already putting extra pressures on a very pressurized system. Next slide, please, Jack. So thank you for your time. Thank you for letting me open this session today. Please connect. I've put my social media handles down at the bottom, but more importantly today, let's help shape, describe and visualize that future vision for the healthcare system and for the planet. Thank you very much, and I'll look forward to connecting with people today.
Such a great keynote. I love the fact you included a bit of Star Wars there when you were talking about innovation, and you have, of course, led us into our first panel discussion of the day very nicely, which is centred on funding and business cases. NHS trusts can pitch business cases to funding bodies, which can be the catalyst for their sites to decarbonise. We'll be exploring how they can be successful in this process. In 2020, NHS England launched their white paper entitled Delivering a Net Zero NHS. Advice has now been established to give information to trusts on identifying, assessing and providing a commercially viable energy solution. The material provided can help trusts craft their business cases and present their ambitions for net zero, giving them more chance of being awarded funding. So our first panel will look at what makes a successful, I'll put my teeth back in, difficult to say at this time of the morning, successful business case, what challenges the process presents, and what funds the NHS has access to. It's always more rewarding for me when our discussions are a conversation with you involved. So for the panels, do use the Q&A function, which I think you'll find on the right-hand side of your screens, stating who your question is for. So let me introduce you to our first guests. We have with us Stephanie Parker, Senior Advisor Decarbonisation for Energy Systems Catapult, Hawarun Hussain, Senior Net Zero Programme Manager for West Yorkshire Integrated Care Board, Michaela Shopland, Financial Modelling Consultant, Carbon Trust, and Dan Saxton, Sustainability Lead at Birmingham Women's and Children's NHS Foundation Trust. So, specs on to see who we've got there. Have we got a full house there? I think nearly. It looks like we've got 3 guests there. So we'll kick off with Michaela, if that's okay. Michaela, just talk us through. Let's start with the very basics. What is the Public Sector Decarbonisation Scheme, and what projects are eligible? Because I'm guessing not everybody necessarily in our audience is fully au fait with what exactly it is.
Right. That's right, Helen. Really pleased to be here as well. So the Public Sector Decarbonisation Scheme is a scheme that provides capital grants for public sector bodies to fund heat decarbonisation and energy efficiency. So it's funded by the Department of Energy Security and Net Zero, formerly known as BEIS, and it's delivered by Salix. It's been going for a number of years now, and it's currently in its 3rd phase. So the third phase is split into 3 funding rounds, and the last of those funding rounds closed in October. The next one and the final one we expect to open in autumn of this year. And so for the entirety of phase 3, there's 1.425 billion in funding allocated for eligible projects. And eligible projects are public sector organisations who are currently running fossil fuel heating systems, which are ideally close to end of life. And they're looking to replace those with low carbon alternatives. So, for example, a heat pump, perhaps. They're very big on whole building approach. So they like to see that paired with energy efficiency measures, which look to reduce the overall demand in the relevant buildings. And while there's no cap on the total amount of grant that can be applied for, there is what's called the carbon cost threshold. So they're willing to fund up to £325 per tonne of carbon saved. And applicants will need to contribute the kind of like-for-like replacement costs of what they would have had to replace anyway. And that's capped at a minimum of 12%. So there's been a number of NHS trusts that have been successful in applying for this funding in recent years. I think Dan probably could talk about some of that, as I've seen that that's one of the trusts. But there are, so it's a popular way to fund this kind of decarbonisation in the NHS, but there are a number of challenges and criticisms that have been levelled at it. So things like short application period, the fact that it's oversubscribed, and that it's first come, first serve, and not necessarily based on need or necessarily the most impactful projects. So while it continues to be an important source of funding, it is not the only one, and trusts should definitely explore other options.
I was going to actually ask Steph from Energy Systems Catapult a bit more about that, the criticisms of the scheme and what support is out there, because she's been writing a guide. But I just want to confirm, I haven't got Steph, have I, with me? Just in case no, I don't think I have, in case my screen's hiding her there. So we'll perhaps talk about some of those difficulties later as the conversation emerges with the other guests. But Dan, if I can turn to you now. I mean, you joined the NHS and Birmingham Women's and Children's NHS Trust 2 years ago after 30 years in the private sector. So that's quite fascinating to me, in that you've got a massive wealth of experience in the private sector and relatively new to the NHS. But what schemes are you looking at to use this money for? explain how you've been involved in and what your experience has been like. Oh, we just need your sound, Dan. If you just want to start again, I don't think we've got your audio.
Hello?
Try again. Oh, there you are. Now we can hear you.
Excellent. Good morning. Thanks, Helen. Yeah, we bid for PSDS 3A, which was the first of that 1.425 billion over 12 months ago. And we have two major hospitals. We have our children's hospital and a women's hospital. We bid for an application for both separately. And we did that because we thought that we could have had one combined scheme for quite a large amount of money, but actually we had a much clearer, simpler scheme at one of those sites and not so much, a little bit more complex at the other site. So we didn't want to overcomplicate our bid, separated the two out, and we were successful at achieving about £53 million worth of funding across both of those sites. Of course, we have to put our own, one of the criteria is we have to put some of our own money into the project to replace those end-of-life assets that are fossil fuel boilers or CHP units currently. We then, sorry, Helen, go.
No, carry on. That's amazing that you got that kind of amount, which is brilliant.
It's life-changing for us from a carbon point of view, but it also has a lot of knock-on effects into increasing and improving care and staff in some of those areas, which I can perhaps talk about a little later. We then bid again at PSDS 3B, and we were lucky enough to receive another 10 million across two sites in 3B.
Wow, that's incredible. I would like to hear more in a minute about how you pitched perhaps your internal business case and also the benefits, as you say, for care and staff. But I'm aware that I haven't spoken to Hawarun, and I'm hoping that I've got your pronunciation of your name right, because we didn't get a chance to speak before. But your story is very different to Dan's, because you've got 25 years plus experience working in the NHS, an old hand in terms of NHS experience, and 14 years in parallel as a councillor. How have you dealt with the Public Sector Decarbonisation Scheme, and what's been your experience?
I don't know if I'm assuming my sound is working. Hi, everybody. I suppose I haven't dealt with PSDS because it's a new area of work, this net zero role that I'm doing at the moment. I suppose my only, I don't want to say negative association with it, is that you have to be pretty fast at typing if you're going to apply for PSDS money. But what I've seen as my new role within West Yorkshire is sometimes the funding is announced and within hours it's all gone. And also, if you're a trust of any size, you'd have to do a lot of prep to apply for a PSDS bid. So you'd effectively have to have everything you need and literally wait for the button to go green and start typing in, and typing really, really fast. I have known two trusts who have missed out by like less than a minute. And that's quite gut-wrenching. If you could end up spending £20,000-30,000 in consultation fee, in preparation, in time to and be ready to submit that bid, and then realise that you've missed it by 30 seconds because you just haven't, or your uploading didn't happen as fast as you thought it might happen. So that's my not so positive experience of PSDS, although I personally have not put a bid in at all. What I wanted to talk about was that there are other pots of money, and where people are successful like Dan is fantastic, go for it. And if you already have a large scheme, if you're any trust, mental health community or an acute trust, if you already have a large scheme and you've done the preparation, then by all means, 100% push to go submit to PSDS. But if that's not going to happen at the next round, or if you're not going to be ready, is to look at alternatives, look at working with the local authorities, your local authority, wherever you are. And when I say the local authority, I mean the local council, or your combined authority, which are the regional bodies where you have a mayor in the system. and actually look at maybe preparing and putting bids in for other large pots of money. And I want to give you 2 examples. So Active Travel Fund, that was launched in February with 6 weeks, I think it reduced to 4 weeks time frame. So Active Travel was only open to local authorities, but the weighting was skewed towards NHS partnership. So as skewed sounds a negative thing. So where you had an NHS partner, you got a slightly higher score. So I thought that was a really positive thing. And the National Lottery, which normally, NHS cannot bid for, and we still can't bid for, but as a partner, we can bid for it. So our partner would apply for that money. Last year, 2022-2023, National Lottery was making a big push for sustainability. So the whole of they had a big push. So they were looking favourably at sustainable projects, proposals. Shall I stop there or carry on going?
Oh, maybe we'll dig a bit deeper into those other pots of money in a minute, if we can. Michaela, how do we overcome the difficulties, the criticisms that you touched at the beginning? Because there have been quite a lot of criticisms of the scheme, how complicated it is, how long it takes, and then, as Arun was just saying, that having to get your application in really quickly to have a chance of getting that money. Are things being done to try and improve the scheme, do you think?
Yeah, I mean, I think to a limited extent. So, for example, one of the criticisms of the PSDS is that it's hugely oversubscribed because it's all public sector, right? It's not just NHS. It's local authorities, it's schools, it's universities. And so I believe with the most recent funding round, they had implemented a trial of what they called sector soft caps. So they had earmarked a certain amount of the available funds for the given sectors in a proportion relative to the amount that each of those sectors needs to decarbonize by. But that was very recent. I'm not sure to what extent that helped solve that issue, but it's clear that these things are they're on the radar, and I think that they are looking to kind of address these, and as well as Harouan said, there are other pots of funding available, so that is just one of a number of other funding schemes that are targeting decarbonisation in the public sector.
Hold that thought, Michaela, because we will revisit the other funding models in a bit more depth in a minute. But Dan, I just noticed there's a few questions popping up from our audience. Paul says, what have you done with the end of use assets?
What have we done with them in terms of, I mean, one of the criteria is that you need to remove them, or at least cap them off, if you like, so they're not in use anymore. We're not at that stage actually yet. I think we're one of the only, if not the only, 3-year project in PSDS funding. So we're just coming to the end of our first year, and that first year has mostly been design and development work, drilling holes into the ground, making sure that we can get good quality water out the ground, that kind of stuff. And then we are now just about to start. Now we're into this new financial year, just about to start a lot of our implementation and building work, because of course, with ground source heat pumps, which is what our schemes are, we've also got a lot of fabric work to do as well to improve the building insulation, so those heat pumps do their job properly. So we're not at that stage yet, but the full intention is to either remove those assets completely or actually leave them as backup, because we're NHS, right? We've got to have backup heating systems. So we'll transfer those systems from primary heating to backup heating systems.
Just tell us a little bit, Dan, about how you pitched your internal business case for this, because I'm sure that would be of interest to people listening today.
Yeah, I'll try and be quick because these business cases are quite lengthy and complex. But I mean, apart from the obvious stuff, which is, this is a decarbonisation project. It's designed to remove, for us, around 9,000 tonnes of carbon from our estate, which is a huge dent into our total carbon. I think this was more of a pitch around the benefit it brings to the spaces with those fabric improvements that we were just talking about. As an example of that, in our maternity hospital, our women's hospital, a new mother could go through the experience of because it's so cold in that building, because the walls are currently very thin, it's a late 1960s, early 1970s building, single glazed building, is that they cannot have skin-on-skin contact with their newborn child.
Oh my goodness, that's extraordinary.
The insulation of these buildings, because it's a decarbonisation project and because we need to re-insulate these super insulated buildings with better glazing, not only means we can provide the right kind of heat to those buildings, but also it means that the patients and staff within those buildings have a much better experience within them. Gosh,
that's an extraordinary example. Again, just looking at the questions, it's actually for you and to Haroon, so perhaps give this one to Haroon. It's a question from Nick. You're both working in areas where in local government has a combined authority and metro mayor. Has this helped in terms of working with your team? Haroon, do you want to take that?
I think we work really closely with our combined authority because they're the infrastructure organisation as a region. So it's really important that we sort of, meet them regularly, find out what their plans are, and also, they find out what our plans are. So if there are PSDS possible bids going in, we make sure that our combined authority is totally aware of it. We've got loads of localised heat hubs, heat generating hubs, but again, supported by the combined authority, not in hospital sites yet. But then when we look at travel and transport, i.e., infrastructure around walking, cycling, the combined authority, they're the decision makers, they're the funders for large scale infrastructure. So it's really important, I feel, that we work. I always say to people, if you're sat there thinking, but I don't know who to contact, tweet them, say, who do I speak to? I always, find that really positive and quick response, rather than sending an email and the email going around the systems for 3 weeks before somebody actually picks it up and says, okay, I'll respond to that. Sorry, go on.
Good advice there, I was just going to say, carry on.
The other thing is the partnership working is a key phrase. It's really, really important. Any bids, any funding that you apply for, will ask for your partners, and make those partners, make those links. So your local authority, your combined authority, but also the local charities and national charities that are within your patch. Or, Pete talked about Innovation Fund. The Innovation Fund, is fantastic for national charities to fund and give us some, some of their fundraising opportunities. And I mentioned the infrastructure, but the other thing when you're applying for funding is data. You need information. You need to find out about your local population, not just your patient population, but about your local population to the hospital, to the trust that you're working at. And your local authority will have stacks and stacks and stacks of data. The other one that I would like to mention is that police and crime commissioners, they have a pot of money, not in millions, but if you're looking for something small, something you want to do with an interactive bus stop or something about IT that's not in millions, they're the people to go to. And the other thing I want to say is most funding bodies look favourably at NHS where they would fund NHS.
Oh, I like your secret stash of funding options and the fact you've been willing to share those with us. Michaela, again, looking at questions from our audience today. Francis says the recently published NHS Net Zero strategy identifies embedded carbon as an important sector of carbon emissions in hospitals. Do you agree this is a priority, or should we focus on operational carbon at this time?
I think, well, firstly, I'm of a finance background, so I'm probably not the best person to answer this, but I think obviously it's been identified, so it is important. However, the NHS has its own strategy, which has been, thoroughly kind of researched and has been approved. So this should be the guiding kind of tenet that you use in all kind of decarbonisation efforts. That would be my opinion. But again, financial person.
Just sticking with you, Michaela, there, Haroon was talking about some quite interesting areas, people who have got little secret stashes of pots of money that could be useful within the NHS. Have you got some examples of trust raising finance in innovative methods?
Yeah, so there are a number of ways. So, for example, I know private finance initiatives, they've had their share of bad press. Then by no means new. They've been around since the 90s. But interestingly, the Welsh government recently has come up with a newer, more innovative approach to this kind of private finance initiative agreement. So these are ways of essentially financing public infrastructure without that kind of sitting on the books of the public organization, which is an important consideration, right, for the NHS due to expenditure limits. And so it typically would involve the private sector building and operating the assets, but also funding that construction themselves. So either through their own funds or through borrowing. And the public sector organization paying a fee, which incorporates all of those elements. So with the new approach that the Welsh government has been using, they're called mutual investment models. And they've used this, there's a trust, Velindra, I think it's pronounced, University NHS Trust. So they are in the process of constructing or updating a new cancer centre, which is due to open next year. And they've used this method of financing. And essentially, rather than the kind of standard PFI approach, which is the private sector fully owning a kind of investment vehicle and fully profiting and having no involvement from the NHS in this case, they have, I think it's up to 20% of the shares in the investment vehicle are invested by the Welsh government. And so there's a share of the profits, but also more importantly, there's a say in the strategic direction there, so that there's influence and the ability to kind of put some social value metrics in there, as well as the typical financial considerations. So that's one way that's quite interesting that we've seen recently.
Absolutely, that sounds really, really interesting. I'm just flicking to the side of the screen again because we have got a lot of questions. Actually, Callum Michaela just says, is the guidance or information on the WG investment model available anywhere?
Yep, there's definitely stuff online. I can see if I can drop that in the chat before the end of the session, if that would be helpful. That
would be great. We are kind of coming to the end, but there's so much more I wanted to ask. Quick question for you, Dan, from Anthony. Are you exploiting emerging technologies and lessons learned during COVID in heating and ventilation?
That's a tough one, isn't it? Because no one likes to invest in things that aren't very well proven yet. It's certainly my experience in both private and public sector, all having limited experience of public sector, of course. So, I mean, you know, look, we'll happily take on. I mean, as part of our PSDS, the answer is no. I mean, I guess ground source heat pumps are kind of not a massively proven technology, but they're not brand new either. So, yeah, we're very investing in those. We're putting solar PV on some of our roofs. We're doing lots of energy efficiency works, but they're the standard kind of things that you'd expect in any organisation. We'll happily look at innovation, but I think we look at it with cautious eyes. If it hasn't had much proven output, then you know it's difficult for us to invest in those.
Yeah, those funds are precious that you've managed to secure. So I guess you've got to invest very wisely with them. I'm just wondering, Dan, whether you can leave us with some perhaps simple advice to increase the chances of a successful application. And also, I did wonder whether you'd experienced what Haroon touched on, that you do have to get in quick because there's so many people trying to access the same funds.
Yeah, well, look, I can only go through what our experience has been. We've been successful in two. We weren't successful in the very first PSDS round that came before this third phase. I can only tell you what's worked for us. So, and I'll try and be quick. We found a contractor that could help us. We did a feasibility study. We had a mini competition with people that had been successful with NHS previously and had won applications for PSDS previously. So we used one of those. That gave us good credentials in terms of trying to write the right kind of documentation to support our bid. They did 6 weeks worth of work to get us to. Now, of course, we're talking about a lot of money. If you're a small, much smaller trust that is trying to bid for a small amount of money, you won't do some of these things. We did some of these things. We were bidding for multi-million pounds worth of work. But I mean, literally, we had a copy and paste document that just allowed us to copy out of that and paste it into the portal. We all know what the portal questions are going to be because Salix tell us. And we just copy and paste. We had 2 laptops set up, ready to go. We're constantly refreshing. So when as soon as the portal opens, we're straight in there and entering our information. If one internet fails or one laptop fails, we can jump onto the next one. And we had our contractors standing on standby on the phone to answer any questions that didn't necessarily come up in the initial documentation, and just push those buttons quickly.
Push those buttons quickly. I love that. Harun, you've got 30 seconds just to tell me, where can we look for some internal support and perhaps internal funding? Give the final word to you.
I think a lot of the trusts will already have connections and contacts with our regional partners, with our local partners, with the national charities. Build on that, work with them, find out who it is and chat to them and build your connections. And then when you're ready to apply, you have lots of first-hand information, and start gathering your information as it comes on. Don't wait until you're ready to apply. Just have a stack of information ready, or data, or whatever it is that you want. Start building your folder up and then go for it.
And as Dan said, keep that finger hovering over the button and press. Time has flown by, as always, on these panels. So thank you very much indeed to our very first panelists of the day, to Harun, Michaela and Dan, for starting off the day with really engaging conversation on the challenges and some tips for funding for sustainable projects within the NHS. We're going to take a very short break now, time to absorb what we've learnt so far. If you do have chance, engage with the speed networking functionality. Perhaps use what you've learned this morning as an icebreaker. Let's meet back here in 10 minutes time at 10:40.